Greetings from Inter-Religious Council of Uganda. As you may be aware, the Ministry of Health in Uganda declared an outbreak of mpox and Ebola, like Sudan virus disease, in August 2024 and January 2025 respectively. Since the outbreak, there has been a total of 4,913 confirmed cases of mpox as of April 2025, of which 37 have died. Similarly, as of March 2025, a total of 14 cases of Ebola Sudan has been recorded, while 4 died from this disease. We congratulate the government of Uganda and partners for successfully ending the Sudan Ebola virus disease, SVD, outbreak in the country. As faith leaders, we extend our heartfelt condolences to the families that lost their loved ones due to these diseases outbreaks. May the Almighty God rest their souls in eternal peace. This new outbreak of mpox and Sudan virus disease is a litmus test for the country's response to disease outbreaks. The Inter-Religious Council of Uganda, IRCU, would like to commend the Ministry of Health for building resilient systems and the swift response while maintaining the provision of other essential health services. Fellow Ugandans, we are concerned with our continued culture of understanding the potential risk of these epidemics, yet these disease outbreaks may be far from over. We want to remind you that our geographic location near the Congo basin exposes us to disease outbreaks, and ongoing civil war in DRC complicates our response efforts. Similarly, South Sudan's confirmed cases of mpox is a stark reminder of how interconnected our world is, and that without urgent intervention, the disease will continue spreading in Uganda. The movement of populations across borders, especially between Uganda, DRC, and Sudan, increases the potential risk of Ebola and mpox spillover. If not checked, this trend is likely to lead to the further spread or resurgence of the diseases countrywide if we don't adhere to the Ministry of Health preventive actions. Our commitment and appeal. We call upon all Ugandans and those living in Uganda to always adhere to the standard operating procedures set by the Ministry of Health. We call upon faith leaders at all levels to support the enforcement of the standard operating procedures and use the Ministry of Health approved information materials to create awareness at places of worship. While social media is a critical tool for community engagement and mobilization, we are concerned about the rumors and misinformation in regard to these disease outbreaks. We call for vigilance and ensure we only acknowledge the Ministry of Health information materials and media messages. Let us all remain vigilant and report any suspected cases of mpox or Ebola or persons with present signs and symptoms to the nearest health facility. Although there is no licensed available vaccine yet to protect us against the Sudan Ebola strain, we thank the Ministry of Health for rolling out the mpox vaccine and the new experimental vaccine trial for Sudan variant of Ebola. We thank our fellow Ugandans, especially young adults, for responding well to the immunization campaign and call upon all of us to participate in this life-changing initiative. We urge you to love and support your neighbors who may be infected or affected by these diseases. Let's just continue to demonstrate our acts of kindness and compassion to those who are struggling to restrain from stigmatizing them. Conscious of the possible misuse of religion, we commit to periodically engage the faithful community on any false teachings regarding faith and healing through various platforms, pulpit, and other liturgical processes. We commit to provide our places of worship as an alternative and viable sources of information dissemination on prevention, treatment, and awareness on epidemics. Conclusion. In conclusion, let us learn from past mistakes and act now, together, to prevent these outbreaks from becoming epidemic that may take the lives of all of us. These public health emergencies oblige us to work together, collaborate closely, be committed, and invest in overcoming these emerging crises. Let us avoid ignorance and acquaint ourselves with the information provided by the Ministry of Health. Misinformation, skepticism, and lack of trust in science and established systems will add to the barriers and deprive us of reaping the benefits of good public health. We thank the Ministry of Health, the United Nations family, and in particular the United Nations Development Program, UNDP, for always supporting the Inter-Religious Council of Uganda to support the community engagement and risk communication pillar. Finally, it is clear that we have the resources which can employ to check the spread of diseases to save our country from an impending health crisis. Taking responsibility for yourself and your neighbor is what is needed to ensure an epidemic-free Uganda. For God and my country. His Eminence Geronimos Muze, Archbishop of the Uganda Orthodox Church and co-chairperson Council Presidents, for and on behalf of the Inter-Religious Council of Uganda.